Hello, hello, hello. Welcome to Moms in the Huddle. We're in the huddle. No parent stands alone. I am your host, one of your hosts, Erica Morgan. I am the mother of Samaj Morgan. He plays at the University of Michigan. He plays football. He is a third year. He's a third year, 3 years. He's a receiver, a wide receiver, as well as a national champion. I'm also the mother of Tyler, which is my eldest son. I always say I look 25, but he's my eldest son. He's going to be 28 next year. So that's me. I'm Erica.
Hey, Erica, go blue, go Badgers. My name is Jillian Blackwell. I'm also a host of Moms in a Huddle. Thank you so much for joining us this evening. I am the mother of three handsome young men. My oldest son is Mackenzie Blackwell. He is 23 years old and an entrepreneur and working his tail off. And then my middle son is Jonathan Christian Perry Blackwell. He goes to University of Wisconsin in Madison. He plays basketball there. This is his third year as well. Him and Shamaj have been knowing each other for numerous years. And then I have a younger son. His name is Robert Blackwell. He's 18 years old in his senior year of high school. So it is busy in the Blackwell family. And we're so excited to be here for this episode and talk about some great things this evening.
Yes, I'm excited to talk about what we're going to talk about. But Jill, I just want to make sure you're good. I know you're not feeling well today as far as your voice is gone, but you're strong in spirit. Is that right?
We pushed through. I was telling Erica earlier. I had a missions trip in Germany.
Mhm.
Following week, the family and I we went to San Diego, and then the following week I had to go to work in DC. So my body was like, first of all, shut up talking, and then sit down. So that's what I've been doing this whole weekend. I was telling Erica earlier, I just had to take a break. And so, yes, I'm probably not going to speak as much tonight, but I'm going to contribute because I'm excited about the conversation that we're having.
I am too. And you know what? Sometimes we don't think about these types of conversations because we're not privy to it. Everyone's probably not getting surgery or doing different things. But Dr. Levy, where he came and talked to us, he's the surgeon, he's the orthopedic surgeon, and also sports medicine surgeon, where he operate on different injuries. He came on our show several weeks back. We brought him back for a second time today to talk about a particular invention, and it's called COVR. And the reason I want to kind of give you guys an understanding of what COVR is, one of the things that I read about, this COVR Medical, what it is, COVR is medical, is dedicated to raising the standard of care for patient privacy and dignity in hospitals and surgery centers worldwide through the design of medical garments that provide patient privacy and dignity, while still allowing medical professionals with the necessary access to perform the procedure. Jillian, how many of us really think about when you're going in for surgery that there is a garment, or a lot of people, as Dr. Levy may explain to us, may go in for surgery, you're asleep, you're out, you don't know who's looking at you and what's happening.
That's the worst nightmare to think about. Even think about what your parents told you when you would leave the house. Make sure you have some clean underwear just in case something happens, right?
Right.
And so when you think about you going to a surgery, I remember when our children, we were pregnant with our children, and we had to have the gown that was split in the back, and I'm trying to wear it the opposite side so I can cover my. Listen, we want some sense of dignity, even when we sleep, even when we're unconscious under surgery.
Yes. And I don't think people think about it because it's like, okay, I'm getting this surgery and different things like that. But I will say one thing about COVR is medical. It's a nonprofit. No, I'm sorry. It's a for-profit limited liability company. It's organized under the laws of the state of Minnesota, and it's based in the city of Rochester, Minnesota. And it was co-founded with his wife, Dr. Bruce Levy is the CEO, but his wife, Heather Levy, and it was formed in collaboration with the Mayo Clinic Ventures and programs designed to promote employee entrepreneurship and to support development of proprietary inventions and technologies that advance patient care. Think about doctors that are thinking about patients beyond the surgical room, right? And that's a beautiful thing. Dr. Levy is one of those people that we see. They also have a vision statement and a mission statement. The vision statement for COVR is to raise the standard of care for patient privacy and dignity in healthcare settings around the world. The mission is to develop and commercialize, I keep getting this word messed up, proprietary medical garments designed to provide patient privacy while allowing for procedural access by medical professionals. So I am excited to talk about this because this invention is very near and dear to Dr. Bruce Levy's heart. And if you guys don't know, let me give you a little background about him. He's an orthopedic surgeon and a sports medicine surgeon in the Mayo Clinic, at the Mayo Clinic in Rochester, Minnesota at one point, but one of the top ranked orthopedic hospitals in the world. So this man worked at some of the top places that I think that we need to understand that he comes with valuable knowledge, valuable different things in which he's given to this profession. He's also he completed his fellowship at the Minneapolis Sports Medicine Center, his orthopedic surgical residency at the Mayo School of Graduate Medical Education, and his medical degree at the University of Montreal. Dr. Levy is a professor of orthopedics, a published expert in knee and hip arthroscopy. He is a member of the Arthroscopy Association of North America, as well as the American Orthopedic Society for Sports Medicine and the American Board of Orthopedic Surgery. Now, his wife, Heather, is not here, but I thought that I would like to also read her bio because she's his helpmeet. So I just want to give Heather a shout out. Heather Levy is an experienced medical device executive, having worked for companies that distributed product lines from Arthrex, Tornier, and VQ OrthoCare. She has served on the board of directors for Ontario Refrigeration, a multi-million-dollar company, and her business acumen and sales capabilities. Oh, wait a minute. Her sales capabilities have been recognized through the achievement of multiple Sales Agents of the Year and other business awards. Heather is a graduate from the University of Southern California. And without further ado, we're going to bring Dr. Levy to the stage because I know you guys want to know what's going on with this new invention he's had. Welcome to the stage, Dr. Levy.
Welcome to the huddle.
Hi, ladies. Thank you so much for having me.
You're welcome.
Thanks for coming back.
Oh, yeah, my pleasure. My pleasure.
Yeah, one of the reasons why I think it's very important, although Moms in the Huddle is a global empowerment podcast, but we are based out of Detroit. And one of the things that people have talked about for years is Detroit is a tech hub. We have multiple organizations that are talking about inventions and supporting tech founders and innovators through workshops, mentorship, funding. And so we want to hear from other inventors. And so tying into the things that you're doing with medicine and surgery, we just thought it would be a great idea for our listeners that are either local or global to hear about some new inventions that have come out. So super excited to hear about the background and why you got started, and super excited that it was not something that you did on your own, but you also did with your wife.
Oh, yeah, thanks. So I do a lot of hip surgery, and people don't realize how exposed they are when they're in surgery. And so in the operations that I was doing, people are literally spread-eagled. They are completely naked. I'm yelling at the residents to put a blue towel to cover them. The blue towel's on the floor. The only way to sort of keep the blue towel in place is to staple it to the skin, which, believe it or not, some places still do. And I just said, like, who wrote the rule that you've got to be naked in surgery? You got people milling about the OR, you got cell phones, you got visitors. I mean, you know, like we have to do better as healthcare professionals in giving people privacy and dignity. So I went online to look for a drape or something that could give people privacy and dignity and still give me access to prep, drape, and do the procedure around the hip. And I couldn't believe I couldn't find anything. So at the time, I worked at the Mayo Clinic for the better part of my career. I just moved here to Orlando a couple of years back. And so I went down to Mayo Medical Ventures, and I asked them to look into it. And not only did they look into it, but they looked into patents, and they couldn't believe there was no patents.
Wow.
So you can imagine how excited they were to, launch all these worldwide patents.
Yeah.
And Mayo developed this, what's called an employee entrepreneurial program, where they allowed surgeons like myself or physicians to develop businesses with obviously their support, and they're a big part of it, and kind of develop your own inventions. And so that was sort of the birth of Cover. And of course, when I brought the idea to my wife Heather, she thought it was terrific. And she had spent years and years in the operating room doing surgical sales, so she's very well aware of how exposed people are.
Wow.
And so off we went to various stores to grab current shorts, underwears, cut, poke, prod, tape, until we finally came up with the design that we thought would be helpful. And we found a local manufacturer at the time in Minnesota. And my brother, actually, who is a marketing expert in Toronto, Canada, I'm from Montreal, Canada, he has a branding marketing company. And he came up with the slogan Cover, COVR. And if you look at the logo, it's actually a fig leaf.
I love it. Listen, I was just thinking that, it reminded me of Genesis when Adam and Eve they were exposed, and God didn't listen, he didn't he covered them. That cover wasn't just clothing, it was compassion and dignity and care. I was thinking the same thing. I love that.
Right. So, but it's no easy task to develop a FDA regulated class 1 medical device that meets every criteria for drape and gown use in the operating room. There's cytotoxicity testing, allergeneity testing. You can't have any latex in it. There's flammability testing. I mean, you can't imagine the process to develop something that passes all of the requirements to be safe to be used in the operating theater. Now, what you have on your screen is actually what we call the bilateral garment. And that's what's used for patients that have angiograms or catheterizations, where the physicians and surgeons need access to both sides of the groin to access the femoral neurovascular bundles. And so you can imagine in the old days, in order to prep and drape and get access to both sides of the groin, in particular if you're a male, you would have a tech that would be holding your genitalia in their hand while they prepped and draped on either side. And then another tech would come in and put a towel, and then it was a complicated process. Finally, they get a drape on. Now you have this retractable front panel, and you pull up on the waistband, holds everything out of the way, and the patient has privacy and dignity, and the technician has easy access to prep and drape and do the procedure.
Wow.
Yeah. And so in orthopedic surgery, which is what I do, the bilateral garment isn't used as often. I mean, if you're doing bilateral hip replacements or knee replacements, it might be helpful. And quite frankly, some people, when we offer them this design or the other design, they just choose this design. But if you go to the next picture, this is what we call the half short. And this is actually my original design, or original invention, if you would, for the hip operations I do. And you can see that the front panel retracts all the way to the midline. And if you need to get up even higher, it's releasable. And both buttocks are completely covered. And so people will have their hospital dressing, let's say on this left leg, and then they're walking around with the t-shirt because their buttocks completely covered. You don't have to worry about the gown.
Wow.
Yeah. And I would say what is most impressive for me is that we are in, how long ago was this created, Dr. Levy? Was this years back?
Well, what's funny is I put my invention disclosure in to Mayo in 2012. 2012. And in 2016, my wife and I actually were introduced to a gentleman named Romeo Catracchia. And Romeo was responsible for bringing Purell hand sanitizer. He led the team that brought Purell into healthcare.
Wow.
And we basically got introduced to him, And he basically shut down his consulting business and came to and worked with us full time and helped us develop the entire business.
Jesus.
And so between him and my wife, we had some pretty heavy hitters, getting things going. And the company launched in 2017, and we're sort of trickling along, all essentially by word of mouth. And of course, here we are now in major leading hospital institutions around the country: Mayo Clinic, Hospital for Special Surgery, NYU, USC. I mean, the list just goes on, and all just through word of mouth. We're just trying to slowly get this into one major hospital institution at a time, and change the standard of care for privacy and dignity.
Wow.
But what I'm most impressed with is, okay, you said it started 2012. Out of all these years, you're the only doctor that said, you know what, we got to stop bringing people in here, just spread them wide eagle, right? You are the only one that thought about this enough to say, let's give patients the dignity to where when we're operating on them, of course, they may not know because they're out. They don't know what we're looking at. But this right here, I mean, it's a number of years. It was 13 years in the making. And then when did it finally hit the shelves, or not the shelves, but to where people were able to kind of come order it and get it out to the hospitals? I know you said
2017. But here's the thing that we've learned over time. We've learned over time that there are many patients that actually avoid seeking health care because they're more concerned about being exposed than they are having a procedure. The other thing we learned is that most people don't know that they're this exposed in front of so many people. So when we offer people cover, they go, well, what do you normally give? And we're like, you're naked. They're like, what? So a lot of patients don't even know. And then this concept that they're out and that, who cares? Believe it or not, the more loss of control somebody has, the higher the level of anxiety. And come to find out through the years of researching this, that it actually is an extremely anxiety-inducing experience for people to have surgery and to be exposed and to think about how exposed they are in front of people.
Yeah.
And there's been several studies that were done that really showed high levels of anxiety. Now, when you have anxiety going into a medical procedure, anxiety leads to higher use of opioid use and poor patient outcomes. And there was a wonderful study that was done in Arizona, where this was published in one of the most prestigious orthopedic journals we have, called the Journal of Bone and Joint Surgery. And they did what's called a randomized clinical trial, where people were randomly selected by a computer to have either a regular hospital gown, like the one you described with the crack in the back, or a cover garment with the hospital gown. And what we found in that study, and again, no authors had any conflict of interest whatsoever, no financial anything, okay? And they were just fascinated by the whole concept. So they asked people if they wanted to be involved in a research trial about how they feel about being exposed in front of medical providers. And if they said yes, then they had no idea, these people, that had anything to do with cover. And it was brilliant what they did. Let's say, Jillian, you agreed to be in the study, and you were randomly selected by the computer to have cover and a regular hospital gown. Every single person around you was also given cover and a hospital gown. So you had no idea this had anything to do with cover. And if Erica was randomly selected to the hospital gown group only, every single patient around Erica also just had a hospital gown. So the patients were what we call blinded. They had no idea this had anything to do with a garment. And then they asked them a bunch of questions about how they feel about being exposed. And on the basic questions about like your modesty, the groups were perfectly evenly matched. And then they snuck in a few questions. Do the garments provided by the hospital meet your expectation for privacy and dignity? And the cover group was off the charts, yes, and the non-cover group was off the charts, no.
Wow.
And do they meet your satisfaction? Okay. Then they said, do the garments provided by the hospital influence your decision to return to the hospital as a patient? And the cover group was 3 times more likely to agree.
Wow.
And then they asked, do the garments provided by the hospital influence your decision to recommend the hospital to family and friends? And again, the cover group, 3 times more likely. So it was the first time that they were able to show that literally the garment, having a cover garment, influenced people's decisions on whether they return to the hospital or recommend to the hospital. This is how important it is to people.
Yes.
Okay? And almost 22% of the patients in that study had actual anxiety about being exposed. Okay. And over a third noted how uncomfortable they were. And the majority of patients said having privacy and dignity was actually a big deal. And that was something, to be honest, I didn't know. I invented this because it was not right. It just simply was not right. I don't know who wrote the rule that you got to be naked when you're in the OR.
Yeah.
And the Mayo brothers said it best. The needs of the patient are the only needs to be considered. Okay? And it was wrong, in my opinion, to have people so exposed. And that's why we set out on this mission with my wife to create something that would give people privacy and dignity. And here we are now with cover being used, across the country, at least in some major leading institutions. And we're just starting. There's really been no marketing or anything, because we're just a startup. There's no funds for that. So we're just slowly, creeping in by word of mouth, which is really exciting to see it all happen.
I love the question that I think Erica just casually mentioned. She said, off the shelf. So I know you're going into, larger institutions, but are you, and my background is marketing, so I'm trying to put my hat on.
Okay.
Are you going into individuals like CVS or Rite Aid, or so people can, because they don't know, they can be going down the pharmacy area and they're like, wait a minute, I didn't know that was available. I'm about to have a hip surgery. My Reggie McKenzie played for U of M for years, just got hip surgery. That was one of his issues. Like, I'm not going to be in that hospital with so many people looking at me.
Right.
Yeah.
So basically, this is something that, as a general rule, needs to have approval, from the hospital to get in, at least initially. And it's only now that we're in so many leading institutions that people are actually bringing garments to their hospital, and people aren't, resisting, like, what's this? They're like, whoa, well, it's being used at the Mayo Clinic and NYU and USC. And they're like, oh, okay. And, so it's now starting where people can bring the garment with them to the hospital. And we're not seeing that resistance where we saw years ago, which is like, what's this? This has to get approval. You can't bring this into the OR without it going through the committees and yada yada.
Right.
So listen, we're in the infantile stages of this, and obviously, we're just trying to get the word out and let people know that there is an option now, to have some privacy and dignity when you're having a medical procedure.
So this is something, Dr. Levy, that people can actually go to the website to purchase?
Not quite yet, no. But right now, it's being used again in these major leading institutions.
Okay.
And obviously, the next phase would be to, have this available where people could just take it and go. And we're getting to that point.
Okay.
Yeah,
So I'm sorry. Go ahead, Jill.
No, I was just thinking, my mind is just going bananas. I'm looking at this one. I'm thinking, what's popular now with women, right? Women get breast induction, but they also get BBLs. I'm thinking, why wouldn't this is perfect for somebody that's given a what's it called? I think it's called butt enlargement. I don't know what the proper name. Thank God I don't need that. Thank you, Jesus.
Yeah.
But this looks like a perfect garment for something like that, right? Am I thinking incorrectly? I just think
anything that requires access to the hip, pelvis area, even the lower part of the spine. In that study I mentioned out of Arizona, it was total hip, total knee patients and spine patients. So anything except OBGYN cases,
Right.
you know.
Right.
But even then, we've had some interest from OBGYN where people would wear this up until the time that they have the procedure. Then it would be, released. They'd have the procedure, and then it would be put back. So there's I'd say the applications for this are almost endless, for surgery and medical procedures. I mean, hip injections, people
Mhm.
that get MRIs that have a little injection first, they use this all the time. And things, any kind of injections around the hip joint. It's not just surgery; it's medical procedures as well.
Oh, wow.
And right now, I would say if people are interested and they're going to be having a surgery, they should reach out to their physician or their surgeon and say, hey, would you guys consider using this? And then we could actually set up trials where
Wow.
we could bring some garments to that hospital or to that surgery center and do a trial. And, hopefully that will lead to, all the physicians and surgeons offering this to their patients.
It's pretty
Wow.
cool. And that's giving patients an opportunity to have an additional voice. They're advocating for themselves.
Absolutely, absolutely. I could tell you one of the most amazing things that happened to Heather and I is there was a patient that had terrible heart, and she was getting cardiac catheterizations somewhat on a regular basis. It'd be like having a heart attack and racing to the hospital and getting the vessel opened up. And she actually we had met her. She had asked to meet us. So this is in Rochester, and we had a coffee with her. And so she had our number. She was in the ambulance on the way to the cath lab and called us if we could meet her there with a garment.
Oh, wow.
Can you imagine that? You're in the middle of having a heart attack, and you're thinking. And this is how important it is to people. We
Yeah.
didn't realize it. There was an article in the Chicago Tribune that said the modesty movement, patients won't take it lying down. And they
Mm.
basically said that this exposure for them was a violation of their rights. And to some, it actually created like an anger response, and they didn't care if physicians and nurses and surgeons had seen thousands of bare bottoms in the past. We used to say, oh, honey, you're fine. I've seen this a million times. Well, guess what? Patients don't care about how many you've seen. They don't
Yes.
care about it. They don't care about it. They just
But
care that they're exposed and they're vulnerable and they have no control.
now our patients told that for you that you can remember that ahead of time. Hey, this is how the procedure is going to go. You're going to be exposed to the entire ER. Are patients normally given that ahead of time notice that you know of by doctor?
I listen. I think that what we used to say in the past is, if people asked, like, "Hey, am I going to be spread eagle?" I was watching a YouTube video. I'd be like, "Yes, but we do everything we can to keep you private and dignified." I mean, it's not like we weren't aware of this. It wasn't like we didn't care. Physicians, nurses, doctors, we all care. There just wasn't anything like this to offer people. There was like, a temporary blue towel, and then the blue towel would be on the floor, it would fall off, or you'd get the stapler and you'd staple it on, and people would wake up with staples everywhere.
Mm.
So, it's not like we didn't care. It's just we didn't have something that could do this.
Mm. Wow. And even the material that you were saying how it's made, it's not like you just say, okay, we just got this material. It had to be material approved for surgery and be in there. So take
Right.
us through that journey, that path, because this isn't just I went, like you say, you went to the store to get some things, but it had to be approved. It's not your patent, right?
Yeah. Oh, yeah. So when we went to the store and we, cut and put things together, that was just to get initial designs. And we found a wonderful seamstress in Rochester that helped us, create some prototypes. And then we went to the manufacturer and got more prototypes. But the materials are, very, very specific, and they have to go through various processes to meet all of those requirements. and they're cut and sewn in what we call an ISO certified area where they do like Medtronic things. Okay, like this is not sterile, but it's very, very clean. People wear gloves and masks and hats and things of that nature. So we try to keep this as clean as we can before, and they're all individually packaged. So then when you take them out, they're as clean as we can make them without them being sterile, and then they go on to the patients.
Mm.
And the
Wow.
patients put them on in the pre-op area. They come into surgery or into the medical procedure area. People are asked to get undressed and put on their gown, and then they're offered a cover garment, and then the nurses show them how to open the package, and they get the size because there's various sizes, and there's a little instruction on how to put them on, and off they go.
Wow. I
So
love it.
when you say patient modesty movement, what do you mean, and what do you want listeners to do with that, like patient modesty movement?
Well, that was the title of the Chicago Tribune article.
Okay,
And so that was something that we just found. We haven't coined that term.
okay. I
But
love that.
I think that as a general rule, people are taking more control of their lives in
Yes,
all aspects of their lives, not just their medical care. They are
Yeah.
becoming their own advocates,
yes,
and they're trying to protect themselves.
yeah,
And people aren't just listening to everyone and taking everything at verbatim. They're educating themselves, they're learning, and they're taking control over their lives. And let me tell you, there's no reason for them not to have control over their most private and intimate areas.
right, exactly. Wow.
Wow. So let me ask you this. Heather Levy, she's your wife. How important was it to kind of have her in on this partnership, and what is her role as it relates to cover?
Yeah, so Heather is the president and co-founder, and I mean, my gosh, we could not have done this without her. I mean, all those days I'd come home from surgery and she'd say, "Hey, I've got a new design to try on." I'd be like, "Oh my gosh, another design." And
Right.
she'd be like, "That's okay. I can hire someone to stand here while I poke and prod." I'm like, "Okay, fine, let me see it." And so she basically was integral in the design. Remember, she was in surgery every single day. So she knows what it's like, in the trenches, if you would.
Sure.
And she was on the board of a very large, very successful company. So she understands from the trenches to the C-suite. And
Right.
so, having that experience to be able
Yeah.
to run an entire medical device business, she runs the whole show. I mean, obviously, we have a lot of people that work under her, but she runs the entire day-to-day operations. She handles manufacturing, she handles sales, she handles orders, I mean, you name it, she's in there. And so, the company couldn't exist without her.
Well, that's great. I mean, Erica talked about she's your helpmate, she's your partner. You talked about she's in the trenches from the CEO's C-suite. And you also talked about Romeo, who helped, with bringing Pearl hand sanitizer. So you got those two, Heather and Romeo,
Yeah,
working side by side. But we know it takes a village, a team. You mentioned there's
right.
other. What are some of the other team members, and what do they do?
Yeah, so we have an entire scientific advisory board. So there's
Oh
people
wow.
in plastic surgery, urology, radiology, people that are, considered leaders in the field in the United States, some worldwide, that have helped us, with design and implementation for, various things.
Yeah.
Just so you imagine, the first patient that used a cover at the Mayo Clinic was actually a teenager with
What?
morbid obesity that was having plastic surgery to remove, excess adipose tissue. And
Wow.
you can imagine
Yes.
standing there while they're marking their folds, if they were completely naked. Now they had the cover. It was like a whole different world. And so
Yes.
that was just, one aspect where, plastic surgery, we didn't even think about something like
Yeah.
that. So
Yeah.
we have an entire scientific advisory board. Then we have an entire business advisory board.
Wow.
So, we have Dr. Mike Rock, who is past president of the American Hospital Association. And we have various, CEOs of medical device companies, past vice presidents, past CEOs, so people that help on the strategic business side. Now, Romeo, he's sort of a startup expert, if you would.
Yeah.
And he actually developed, he was a president of Tyco Canada. He worked for Covidien, Smith & Nephew. He did Ansel Perry surgical gloves. I mean, this guy's pedigree is off the charts. And Purell actually struggled for many years to get into healthcare. And Romeo actually led the team that brought Purell. I mean, you can't walk 5 feet now without seeing Purell hand
That's
sanitizer.
right.
Okay. And so he looked at Cover and he said, Cover reminds me of Purell. And I think with the right, events, Cover is going to get into every hospital in the world the same way Purell is. And so, we're trying. We're trying.
I love that. I remember when I worked for Microsoft and we started putting sensors. We had some large customers, hospitals, and we were putting sensors outside of patients' rooms where we were tracking to see when a nurse or a practitioner came into the room, if they were using the hand sanitizer.
Yeah.
And the increase where there were like medical infections. We measured all of that. And so
Right.
to see how all of that ties to other organizations and companies supporting. So I can imagine all the connections that you're going to have with companies that are, other companies like we have with Microsoft measuring.
Of course.
Hand sanitizer.
Yeah.
So it's very interesting. It's all
And
connected.
we have a wonderful sales manager that travels around the country and basically sets up these trials at various hospitals and surgery centers. So Laura Snow is her name. She's an integral part of the team as well. And over time, we've had obviously an incredible amount of patent attorneys and employment attorneys. And I mean, putting together a business is a very, very big undertaking. And, we have regulatory people for, when we're going through our regulatory process. So it takes a village for sure. And at the end of the day, you just have to know that it's never wrong to do the right thing.
Yeah.
And you just, here's something now, like if somebody shows up now into my OR, let's say for some reason they didn't get a cover by accident and they show up, I'm like, oh, whoa. Like it now that I know there's something to cover them, it feels wrong to me,
Wow.
And so it's amazing that part of the journey, because when I was younger and I was looking at this every single day to put, prep and drape and put tourniquets on, you try to block it out. But at the end of the day, when people were so exposed, I mean, it just wasn't right.
No, it's not.
You're driving home with those images and you're like,
Right. But I think that when you're thinking about surgery, most doctors in emergency situations, sometimes you can't get cover on. But when you have the opportunity to schedule a surgery for someone to come in to be able to cover them as it relates to have their dignity, because I'm gonna be honest, I would not want to be uncovered in the OR, and you are just sitting there looking. I'm a woman, and sometimes women have doctors that are males. Sometimes males have doctors that are women. And so to have that available makes me feel that, especially a doctor like yourself, care about the dignity of the patient. Now, I was looking on your website and it does talk about you guys are promoting what they call employee entrepreneurship. What does that mean as it relates to cover?
Oh, well, basically what was happening with Mayo is that if you had an idea, Mayo owns your intellectual property. And so it was sort of very complicated how that all worked. And so I can't remember what year it would have been, but probably, 2010, 11, 12, somewhere around there, they developed the Employee Entrepreneurial Program, this EEP, where they allowed physicians and surgeons to present ideas to them. And if they thought it was a really good idea, then they would actually support and basically get all the patents organized and pay for all the patents, and they would own a part of the company, and they would have royalties and all these other things, but they would allow the physicians and surgeons to actually develop their own businesses. Of course, they own a part, and the companies pay back for the patents, but that you weren't like on your own. They really helped you to get things on off the ground. And what was interesting is that a lot of the businesses or companies that they started through the EEP, they weren't actually using in the hospital because of a perceived conflict of interest, because they have a financial stake. But with COVR, the ethics of not using it superseded the conflict, right? It's the same thing. Once you know it's there, how do you not offer it to people? And by the way, in our nationwide surveys, when Laura goes out and she does trials in all these different hospitals, we actually give the patients, the doctors, the techs, anyone that's involved in COVR, we give them these surveys, like, quality of the product, and, did the patient accept it? Was it easy to understand? Things like that.
Yeah.
And 98% of the patients said it lowered their anxiety levels. Okay. So, I mean,
that's awesome.
Yeah, it's good, but it's, hopefully with time we'll get to a point where people can just go to Walmart or CVS or just pick it up, and the hospitals will all know about it, and people can just walk in and use it.
What is going to be so amazing is when your children are walking in Walmart, or of someone that you knew. I knew the guy that invented when you and I, Erica, walked to CVS or whatever.
Right.
We had him like a year ago on our podcast. So it's always great to be able to say that I had an idea, followed the dream, and now I see the manifestation of it. It's that I think that just that alone, and that you're helping people. And so one day, Dr. Levy, you're gonna be in a Walmart somewhere.
Yeah, that'll be really neat. I could tell you though, already there isn't a day that goes by that patients don't say, because people hear about it. Oh, Dr. Levy invented this, or he and his wife did this, and so I can't recall a day where people haven't thanked me.
That's awesome.
So whether the business, hopefully it'll be a success in the future, and it'll be everywhere, which is our goal. But we already have had such tremendous thanks from so many patients. I mean, there was a patient in New York had a knee replacement, and the surgeon sent us a comment that he wrote to the hospital. Said, I've always had so much stress and anxiety going into surgery, and when my doctor came out with the COVR garment, it answered my prayers, and I felt like a human being again.
Wow.
Okay, I'll never forget that. I mean, I'll go to my grave and I'll remember that comment.
Yeah.
So,
that's awesome.
Yeah.
That's amazing.
Okay.
Yeah, you have an amazing story. When we think about the first time we had you on the show, and you talked about how you as a kid, saw a doctor, and so can you imagine how many younger younger Bruces that are out there, or Nancy or Jill out there saying, not only can I be a doctor, I also be an inventor. That's amazing.
Well, let me tell you, I never thought of it that way. I just saw that there was something that wasn't right, and I just felt I had to fix it. Same way I fix blown out knees. It's just it's not right, and we have something now that we can make it right. And so that part feels really good. And I've been blessed to have my wife and Romeo and Laura and other people around, and my brother, to help support all this. So it takes a village for sure. It's certainly no easy task.
Yeah. So I would like to know, if you're able to, I know that we're talking about the garment itself, and it can be obtained through your doctor, but what is the cost to making something like this? And would it be something economical for the general public when it is available in the future?
Yeah, well, I can't discuss the cost of goods. That's proprietary information, as they say.
Okay, I understand.
But this is not an expensive product by any stretch of the imagination. In fact, we've purposely kept the cost low so that like nobody could say, "Oh wow, that's too expensive," you know. And so there is nothing cost prohibitive about this product. That would defeat the purpose.
And I don't know why doctors everywhere, I don't know if you guys, I'm sure you guys have all kind of conventions. Like this should be put in your, if it's not already, in a lot of the conventions that you guys have to where each doctor in the United States knows that this is available. Because like I said, 2012, that's too long to go.
Well, it took 5 years just to commercialize the product, right? To develop it.
Right.
And so, you know, we've had what we call this limited market release where we've had trials in these various hospitals. I mean, usually what happens is I'm at a meeting and someone says, "Hey, we got cover in, the patients love it, you know, thanks so much." And then the guy or the girl next says, "What's cover?" "Oh, well, Dr. Levy and his wife developed this thing." I'm like, "Really? Well, why can't I try it?" I'm like, "You want to try it? Sure, we can help you set it up." So as a startup, there's just no funds right now for any kind of like, you know, marketing campaign. We're just trying to stay afloat. And so basically we've built this business by word of mouth. And we've managed to get it into some pretty, you know, very, you know, powerful leading hospital institutions around the country.
Wow. You and your wife just need to go on the Shark Tank.
Well, interestingly, in Minnesota, they invited us to what's called the walleye tank competition because they don't have sharks in Minnesota; they have walleyes.
Okay.
And we got invited to compete in front of about 5 venture capitalists in the annual walleye tank competition with 13 other medical startups, and we actually won as the best new medical startup in Minnesota at the time.
You should have, Dr. Levy, because when you think about an invention like this should be near and dear to everybody's heart, including the doctor. Doctors can go under the knife.
Yeah.
And want to use this.
Doctors and medical providers are a little uncomfortable too. I mean, it's the elephant in the room. You're never going to have a patient that's going to say, "Hey, Dr. Levy, I know you're going to be doing my hip surgery, but I'm not comfortable with you like seeing me exposed," right? Like it's not a conversation any patient has ever had with me.
Right.
And nor would I ever have a conversation with a patient saying, "Hey, by the way, I'm going to be doing your hip surgery, but I'm a little uncomfortable like seeing you exposed," right? Like these just, for whatever reason, those are not comfortable conversations. And so, but let me tell you, there are times where it's uncomfortable for medical providers. We have some doctors that do a lot of injections around the hip and pelvis, very, very close to the midline. Okay, they do these ultrasound guided injections for like tendon attachments. And let me tell you, you're right there, patient's wide awake, and you know they're holding their underwear a little bit or who knows what, and it's really uncomfortable for the medical provider too, right? And so you always want to have somebody else in the room to make everybody more comfortable, right? You never be alone in the room. And with cover, because it has the retractable front panel, it literally, they just pull that over and they prep and go. And it just eases the comfort for everybody involved.
Yeah.
So, you know, it's but nobody talks about it. It's the elephant in the room.
Yeah.
Yeah, I think that people don't know what to. I think that when people think about surgery, they're thinking about the need of getting whatever's wrong with them fixed, right? But what happens is when you're dealing with going under the, like they say, the knife or whatever it is procedure you need, you may be embarrassed to bring it up, but just think when a doctor just said this is available for you, it will ease a lot of people's mind when it's just given and it's offered without it even needing to be asked for.
Right.
Yeah. And that's where it is at these major hospital institutions now. They're just offered to every single patient in certain procedures, okay, where it's like a standard of care, where they just offer the garment, you know. And what's always funny, I remember the first patient that my wife actually came and offered the garment to. It was a young girl that had traveled from Brazil for me to do her surgery. and they were through the interpreter, and Heather said, would you like to try this? And the mother said, well, what do you normally give instead? Like, what's the alternative? And when Heather said, there is no alternative, she's just naked, the mother was like, what? What? My 13-year-old girl is going to be exposed in front of all these, what? So people, I don't think, understand, and understand just how exposed that you are.
Yeah, I didn't think about, man, you just brought back some memories. 'Cause I'm thinking about both of my sons who had surgery. We think about you're putting you're putting in your children's life in the hand of a surgeon, right? And then two, you're right, they're teenagers, they're growing men, right?
Right.
Oh my goodness.
Yeah. So listen, it's one of those things where, everybody has a certain level of anxiety about it. I don't know that they think about it or they choose not to think about it. But in that study out of Arizona, the majority of people, it was a big deal. And in over one fifth, like 22% of the patients had actual like stress-related anxiety, not like feeling uncomfortable, but like true anxiety over being exposed. And a third of the patients were uncomfortable. I mean, this is, this is significant. And we didn't know at the time. I just knew that it wasn't right. I didn't know how much of an effect this was on patients.
Well, we get it. I'm sorry, go ahead, Erica.
No, I was saying he had what you call a God idea, because like I said, I'm just flabbergasted at the time it took for one doctor, not 10 to just, hey guys, we need to think of one doctor to say, wait a minute, in 2012, out of all these years,
this is not right.
2012 to say, this is not right. We need to make sure our patients have dignity in it. That was truly a God idea, to where you give the patients their dignity back in the OR room.
And I love that you did the study. I mean, one of the things that we say when I work for Microsoft, we say it at Amazon, is follow the data. And so you have data to show. I mean, I remember when I was having surgery on my eye and got dressed and everything, nurse was taking my vitals, and the doctor came in and said, you look cool as a cucumber. Your blood pressure is too elevated for us to have. And it was because I was anxious. I was, I said in my mind, it's going to happen. It's going to happen. It's going to happen. Went through everything. But so can you imagine and it was just my eye. I mean, not just my eye, but it was, I was having a biopsy, but imagine if it was some other area that I got the pressure on, I'm having surgery, pressure on, it's in this, public area that should be private. It's not public to everyone else. My blood pressure would have been off the roof.
Yeah, for sure.
Yeah.
Well, Dr. Levy, you've given us an insurmountable amount of information. I'm going to just show your website as well. I know it's not cover like COVER, but it's COVR Medical.com, to where people can just get more information about it to provide to their medical professionals. And they're able to get this information, at least to where they're able to look at it, research it, understand what the invention is about, and they may want to take this to their medical professionals to be able to have this for their surgical procedures.
Well, that'd be wonderful. Jillian, I just sent you what's called an infographic. When the study got published in the Journal of Bone and Joint Surgery, again, which is our top journal in all of orthopedic surgery, okay, as a blinded level 1 randomized clinical trial. That's the highest level evidence. And JBJS on their own put out this infographic to sort of alert people. So you want to talk about the data, let me know when you get it, and maybe you could pop it on your screen. And this is the data, okay? And so it's a little bit blurry.
Yeah.
A little blurry, but the top left says 22 or 33%, and the top right is the 22%, and that's the comfortable and the uncomfortable. And basically, in the yellow, in the conclusion, it says to ease preoperative patient exposure-related stress and anxiety and increase patient satisfaction, hospitals and healthcare providers should consider providing medical undergarments.
Bottom
See?
line.
And the title, Addressing Body Exposure Related Anxiety Among Surgical Patients.
Wow.
Yeah.
Wow. They could just patients in general. I mean, certainly surgery, but we see the white coat and our blood pressure's skyrocket. Add a knife to it. Somebody's gonna, cut something. Then
Yeah.
exposed.
Yeah.
Triple it. So that's fantastic.
If you want, I can send you. NBC actually did a little feature way back in 2017 when Mayo started using it, and it got aired nationwide. This little 5-minute blurb about all the stress and anxiety people have, and I could send that to you, and you can maybe post it if you like.
Yeah, that'll be awesome to share with our audience. We can post it on our website too, because I think that a lot of people don't talk about it because it's like a taboo subject. It's taboo to say, hey, you're seeing me when I'm open like that. So I think that us bringing awareness, that's what we do in the huddle. We make sure we bring awareness to issues, to things that people may be, what do you call it? They may be encountering, but they don't talk about.
Right.
So it's huge to bring Dr. Levy today, and we definitely thank you for your time. We're going to bring you back. I would love to bring Heather back with you because I want to get her take on just the process of what she went through, just as you're in this thing.
And what she's still going through.
And what she's still going through.
Running a medical device company.
Exactly. And that's huge. So, yeah. Do you have any other questions for Dr. Levy?
No, I'm just thinking about the folks I know might be having surgery. That's what I'm going through my list right now.
Yes. Yeah, and it's amazing. My dad actually just had he had surgery today, but I think about that.
Hope he does okay.
Yeah, he's okay. And it was, something to deal with, on the stomach. But I will say that's probably where they had to cut where the garment would be. I don't know, but it could have been something available to him too. He's in his, almost in his 80s. So I think that when you think about surgery, you do think about your loved ones. You think about now your children. When you brought that 13-year-old girl up, you think about your children going into surgeries that we think is so, they'll be okay in there with the doctors and stuff. So, yeah, we appreciate this today, Dr. Levy.
It's my pleasure. Thank you so much for the opportunity. It's great talking with you guys again.
Thank you. We're going to have you back. Have a great one, Dr. Levy.
Thank you.
Thank you.
Bye-bye. Wow, Jill. Every time we do an episode.
No, go ahead.
No, I was just saying, every time we do an episode, it gets better and better and better. Like, I love it. That was a lot of good information for a lot of our audience out there that may have loved ones that want to know about what this is that Dr. Levy was talking about. Let me go ahead and put the website back on and just a little bit of information that we talked about today. So this was really, really good.
Yeah, very valuable information for student athletes, their parents. I mean, it goes beyond just the folks that we may be our direct audience, but it can be to what you said earlier, our parents. Like I just said, Reg just had surgery, so I'm sure there are things that people are conscious about. It may not be verbalizing, but now that we have the information, we can share with them.
That's the thing. They don't verbalize it because you don't think about it. It wasn't until I think we spoke with Asia about it when she came here. She was talking about Legal Shield. And then we talked to Dr. Levy before, and then we're talking to him now that I thought to myself, it doesn't even pop into my mind, surgery and how we don't have the privacy at that moment when we're having a surgical procedure and we are open to the world, for things to happen to us. Now, I mean, and to be honest, we didn't kind of touch on it with Dr. Levy, but you don't know who's in that surgery room observing you and may have different things that, after they see you and they're like, wow, I've seen everything. I've seen for some young men, and let's be honest, this is Moms in a Huddle. I done seen your package, and you're sitting here like, you don't want to have that in the mind of people's impressions.
Because we're all still humans, right? You think about that's why I love the fact that it was fig. God covered them up because they knew that they were naked and exposed. And so I love that they tied that in, that it is an honor and a privilege and a dignity to be covered up, right?
Yes. Yeah.
No, this was very good. I learned a lot. I said I wasn't going to talk much, but I talked a whole bunch.
You know, Jill, you can't help it. I do the same thing. Me and you can't help it.
Yeah. I mean, you see, I'm sipping on my tea too. So, but this was great. This was great, Erica.
It is. It is. We have some great shows coming up next year. Me and Jillian, we're going to be doing all kind of things next year. Get ready for Moms in the Huddle. We're doing great shows, bringing great guests, some guests that maybe you didn't even think we knew or think of. We're going to bring great, conversations where you are able to join in with us. Meaning it's just not me and Jill talking. Come to the stage. It may be a controversial conversation. You may like hear, you may not like what you hear, but nonetheless, you'll still be in the huddle with it.
Yeah, I love it. I love it.
Yeah. So, but other than that, Jill, you take care of yourself because you got to get some rest.
I am going to get some rest, even though I got some work to do before I got early morning meetings. And so I got to get some stuff done.
Okay. Did you have a moment, or did you want to talk about anything else?
I don't know. I can't say anything else.
Okay, we're going to catch up on our legal moment and our marketing moment on our next episode. We will be addressing a lot of other things that's happening in the sports world, big topics that are happening in the sports world, where we're going to talk about it. We're in the huddle. This is what we do. We're not going to shield away or shy away from things that may be embarrassing, but we're going to talk about it in a respectful way that is going to provide wisdom to every parent out there, that when you got an athlete going through adversity at any university, how do you handle it?
Absolutely.
So that episode will be coming up soon, and Jill's going to give her wisdom and knowledge, and we may bring an expert on how to handle these situations.
I love that. I'm looking forward to that conversation. And
Yeah.
it's coming.
Yeah.
All
Well,
right.
Have a great day, everybody. Love you, Jill. And don't forget, like, comment, and subscribe. And no parent stands alone.
Absolutely.
All right.
Erica. Bye-bye.
Thank you. You too.